That's the rest of the news. Today, current and former leaders from across the globe gathered in Johannesburg, South Africa, for a memorial service honoring the life and legacy of Nelson Mandela. And part of Mandela's legacy that's being honored is his undying support for universal health care. In fact, thanks to Mandela, the South African Constitution reads, "Everyone has the right to have access to health care services, including reproductive health care. The state must take reasonable legislative and other measures within its available resources to achieve the progressive realization of each of these rights." As John Nichols points out in his latest piece for The Nation, Mandela fought hard for broader human rights in South Africa, and when the South African Constitution was ratified in 1996, he said that the new Constitution obliges us to strive to improve the quality of life of the people. In this sense, our national consensus recognizes that there is nothing else that can justify the existence of government but to redress the centuries of unspeakable privations by striving to eliminate poverty, illiteracy, homelessness, and disease. It obliges us, too, to promote the development of independent civil society structures. All across the globe, countries are beginning to listen to the wise words of Mandela and realizing that health care should be a universal right. But here in the United States, even as Obamacare begins to show just how successful it can be, Republicans are arguing that universal health care is not the answer to America's health care problems. They still believe in a system where only the wealthy have access to life-saving treatments and medications, while everyone else is forced to build up mountains of medical debts because of high insurance premiums and pre-existing conditions. So isn't it time Republicans embrace the legacy of Nelson Mandela and help to make health care a right for all Americans? Joining me now for more on that is John Nichols, Washington correspondent for the Nation Magazine. John, welcome back.
It's a pleasure.
Adam Thompson, libertarian radio host and attorney in New York City. Adam, welcome back.
Great to be back, Tom.
Great to have both of you with us. So, first of all, John, just recap. I think I told the story.
You told it very well.
Reasonably, but
look, the bottom line on this is that Nelson Mandela, who we are honoring today, and perhaps making even more of a hero than he himself would have wanted to be, is now being kind of reviewed for all the things that he really focused on in his life. And there is no question that one of the things that was very, very high on his list of priorities was this access to health care. It was a big deal because in South Africa there was a real division between a white minority that got health care and a great African-American population, or African population, I apologize, that didn't get access. Now, Mandela was a man of a certain enlightenment, and that enlightenment period was the World War II era. He was a young man at that time, and it is important to understand that his ideas about universal health care were founded in Franklin Roosevelt's Four Freedoms. It was Roosevelt who began to talk about access to health care as a right.
Germany had had universal health care since the 1890s.
Oh, of course, and other countries, Scandinavian countries too. But when Roosevelt put those Four Freedoms forward in 1941, and then Eleanor Roosevelt came forward as the chair of the committee that developed the Universal Declaration of Human Rights. This was at a formative period in Mandela's life, and it is not coincidental that when the Universal Declaration of Human Rights was honored at its 50th anniversary, it was Nelson Mandela who went and gave a great address to the United Nations in which he spoke at length about that right to health care.
So, Adam, why would Republicans suggest that we don't have a right to health care? I don't understand this.
I've been on your show before, Tom, and you asked me that exact same question, and I can't tell you why they would. I think that in this day and age, there should be a right of every person to have health care, just as it's stated in the previous clip that you showed. I think we're at the point in our lifetime that everyone is entitled to care. The fact that we don't have it in the United States the way it should be, like other civilized countries, you can go down the list. Japan started it in '61. Their economy wasn't thriving at the time, and once they put it into effect, it took off and it worked. It's been going on for years in England, in France, as you said before, in Germany, Canada. It's successful everywhere that it's done, and you're satisfying a basic human right that everyone should have, that no one should be left out, everyone should get care when they're sick. It's that simple to me.
How is that a libertarian position, Adam?
Well, again, you have me on as a libertarian. I don't think it's a libertarian position, but I'm not a libertarian. Like I told you before, I call each issue as I see it, point by point. On health care, it should be available to everyone. It should be a right, period.
Yeah, okay. So, John, Colin Powell, former Republican Secretary of State, applauded European single-payer health care system at an event last week. How long before people who identify themselves as conservatives or on, to the right of things start talking the way that Adam just did?
Well, I think it may be a while. We have a great wrestling match for the soul of the Republican Party at this point. And I would not lie to people and tell you it's going to get resolved even in the next cycle. I think it's going to take several election cycles. And frankly, that we will see what the voters tell the Republican Party about the viability of its ideas. But this is something to understand. Why are Republicans, at least some conservative Republicans, so virulently opposed to a universal health care plan? I think one of the core reasons is because they know that when plans of this sort are implemented and when they begin to really work, then that issue is taken off the table, much as Adam is suggesting. It doesn't become a conservative liberal issue anymore. Everybody's on board with it. And what's important to understand is Margaret Thatcher, the great hero of conservatives, presided over England with a national health care plan. She did not treat that plan well. I'm not trying to...
Yeah, she kept trying to hack away
but
at
she
it.
never proposed to get rid of it.
Right.
Never. And similarly,
if I could jump in,
when conservatives come to power,
and say something,
they
Tom?
never proposed to get rid of universal health care.
Adam would like to. Yeah, go for it, Adam.
I think an important point that a lot of people miss is if you listen to a lot of the rhetoric today from people that oppose a single-payer plan and universal care is that we can't afford it, it won't work. They give you all the different pitfalls. But I'd just like to raise one point. Look at all the countries that have been doing it for decades and decades and decades. Did it fail there? Did they stop and say, hey, we're going bankrupt, this isn't working, we have to change the program? No. Of all the things they're doing in those countries that work, the universal health program is the one that does work. Maybe other parts of their economy are failing, or the trade deficits, all those different things come into play, but that part of it is working. So using that as a template, we should implement it here. It would certainly make the working, the working class lives much easier if you have built into, your spending of money, healthcare taken out through taxes, let's say. Could you imagine that you could make the same money, but healthcare is paid through the taxes that we're already paying? Let's maybe cut back on what we're spending on producing 4,000 million bombs that we don't need, and cut back on military, say, to a degree, and just put it towards healthcare, put it towards education, things that will really advance our culture and our country, will really make a difference.
I think the core reason on why so many Republicans, so many conservatives, and virtually every libertarian I've ever met are so opposed to a national health care system of any kind, is, whether it's single payer or whether it's national health like England has, is that it demonstrates the government actually can do some things well. And the billionaires who fund the Libertarian Party and in general, I mean, the big business, if people don't trust government to be able to do things well, if government steps back in pretty much any area, it creates a vacuum into which business can step and, basically make a buck off the commons. So how do you respond to that argument that this is going to cause people to trust government?
There's some things that it's all right to trust government. I'm all about maintaining individual rights, trying to keep the government out of our lives as much as possible. I'm against all the spying that's going on. There's so many different things you'd attack the government on. But education shouldn't be one of them. Healthcare shouldn't be one of them. You need to implement those systems the best way you can, and usually it is through either the federal government or at the local level or the state level. Okay. But it has to be done somehow. No matter how it's done, let's just do it and make sure that people are provided.
Let me just suggest that there is certainly a modified libertarian argument for this, which is that if you can take the burden of paying for health care off the table, then people can start to really focus on a small business, focus on doing something that they might not be willing to do if they were afraid of losing their health protections with their employer or something like that. So now, it's certainly not classic libertarianism, but the fact of the matter is that I do believe that you can give people freedom by giving them access to health care.
Well, that was the essence in July of 1936, Franklin Roosevelt. You know,
Yes.
a necessitous man is not a free man. You're not free if you're hungry. You're
And I
not
think
free
this
if you're
is a
jobless.
well understood concept universally around the world. It is one that, unfortunately, in America has taken a little bit longer to take hold.
Yeah, and libertarians would say, no, that's not true. That's not what freedom is. Freedom is you're motivated because you're